Diabetes is one of the most common non-communicable diseases. According to the International Diabetes Foundation, the prevalence of diabetes in adults is an estimated 14.8% as of April 2022. The National Wellness Centers will be hosting a series of health and wellness fairs and expositions throughout the country. The first session is carded for the 30th of October 2022. This morning, Executive Director Neptune joins us to share more about this initiative and the theme of reversing diabetes. Director, good morning.
Good morning, Asha. Thank you for inviting me to your show this morning.
It's wonderful to have you here, and it's great to have a conversation about such a powerful event and an ongoing series of events that you are going to have in Trinidad and Tobago. Because if it's one thing that we do know, diabetes is prevalent, and we all need to be as informed as we can and as aware as we can to make the right choices. Now, interestingly enough, with this in particular, your theme, Reversing Diabetes, taking a look at your association, if I'm not mistaken, you really do, of course, a lot of outreach and that sort of thing, but you're also really honing in on reversing diabetes. So can you share a little bit about that with us?
Yes. What we really do is present a message of hope. Two main things is diabetes is reversible, and secondly, diabetes is not in your genes. We learn to be diabetic from the things that we do, and we learn it from our parents, because our parents have habits that they hand down to us.
Yeah.
Not in our genes. Now, diabetes is reversible because it is caused by what you do and what you eat. And if you change what you do and what you eat, and our culture of eating the wrong foods, diabetes also changes. The problem in our country is that when you go to get help for diabetes, they push you towards medication.
Right.
And they don't give the opportunity for lifestyle change to work. The rest of the world is moving towards lifestyle change. People don't lose limbs and go into dialysis as often at the rate that we do in the Caribbean in the rest of the world. And it is because we are not given enough opportunity to deal with changing our diet and changing the things that we do and the things that we eat. A lot of people feel that by drinking less soft drink and juice and stuff like that, you bring down your sugar level. Yes, it's true. But most of the sugar we eat is from the food.
Right.
3 spoonfuls of rice has as much sugar in it as a soft drink. So imagine you are drinking 3 soft drinks every day. And that is in addition to the juice that you're going to drink and all the other stuff. And pastries and bread and flour are the main culprits of it. So we need to stop eating grains, rice, flour, corn, oats. Everybody thinks oats is good food. But oats has a lot of sugar in it. And unless somebody tells you that, you will not know. And the whole world, well, not the whole world, the whole of the Caribbean are not aware of it because we are not focusing on lifestyle change. And lifestyle change means changing your food, changing the things you do, exercise, drink enough water, get involved in your community. That is all part of it.
And Dr. Neptune, I can hear the excitement and the passion in your voice as well when it comes to this. And you just mentioned, of course, getting involved in your communities. And I know there is also the guidance of a healthy lifestyle, consistency, and of course, changing your diet. But let's go back to the communities for a second, because your event that's taking place, the first of a series, is going to be at the Bonaire Community Center,
Bonaire
correct?
West Community Center this Sunday, October 30th, from 9 to 3 p.m. And it's the first in a series because we want to get this across the country, including Tobago. We're not going to leave out Tobago. We have a center in Tobago as well.
Right.
And the message we want to bring is a message of hope. That one, diabetes is reversible, and diabetes does not have to be in anybody's future. Our programs, we've helped more than 2,500 people over the last 3 years. And we've helped them because we've realized that when you make healthy choices, there are no downside to it. There are always downside to using medication and using herbs and all of these things. Not to mention, most of the herbs, we give them superpowers. Food is just food. You know, you haven't taken this herb or this turmeric or something like that every morning doesn't change the fact it's just food.
Yes.
If you do not make right choices, no turmeric could help you. So you have to eat properly. You have to identify the foods that is getting you ill, as well as change your lifestyle as well. And it's not just a simple matter of saying that you're going to eat less of this and exercise more, But it has to be a more encompassing engagement. And oftentimes, you require assistance to do it because nobody's going to tell you what the healthy foods are.
Right.
There's too much money being made by selling you the wrong foods. And that will continue unless we make the changes and understand it and research it ourselves.
You're making some powerful statements there, and
Absolutely.
I can only imagine what's going to be happening at the event on this weekend.
And everything I'm telling you is backed up by data. For example, we know that lifestyle change works. We know that medication doesn't work because we have people who are on medication for 30 years and they're still sick.
And they're still sick.
Well, then therefore it's not working.
So share with us, with your event that's coming up this weekend, what services or perhaps displays you may have?
Yeah, we are going to be doing testing and screening.
Okay.
We're going to have a huge discussion about how diabetes can be reversed because diabetes is not in everybody's future. You can make choices now. The other thing is that a lot of people believe that they are diabetic when their blood sugar starts to go up.
Yeah.
No, you used to be diabetic like 15 years before that. When it starts to go up, it just says that your organs are unable to keep up with the amount of sugar you're eating. But your body is showing all the symptoms of it. Another survey we did, we realized that 80% of the population who are over 30 years old are diabetic and they don't know. If you are not sick and you are overweight, you are most likely diabetic and don't know. And you're just waiting. It's a matter of time before your sugar starts to go up. And you need to act on it before you reach that point. So our event on Sunday now, we're going to be dealing with all of that. We're going to expose people to some of the better foods that they can have. We are going to have an exercise regime as well.
Okay.
We're going to be talking about all the things you can do to prevent diabetes from coming. We focus really on the people who are already diabetic. But the same techniques and approaches that is being taken by people who are not diabetic as yet will prevent them from being diabetic in the future.
So it's about
because your granny is
measures.
diabetic does not mean you're going to be diabetic too.
So you're going to also, there's access, of course, to education in particular as well,
Yes.
showing people what can be done, and preventative measures is so important.
Yes.
What time is the event starting?
That's at 9 a.m.
9
at
a.m.
Bonnet West Community Center. And over the course of November, which is Diabetes Month, this kicks it off for us.
Okay.
We are going to be at churches, and community centers, and corporations across the country. If you want to contact us about it, you can contact us at 788-2375, WhatsApp us, and we'll give you that information.
Wonderful. I mean, I feel as though I wish we had more time, because this is such an important conversation that we do need to have, especially when it comes to reversing it, because it's not always that you hear that reversing diabetes is something that can be achieved. We go to the doctor and we're just put on medication, and we just assume we're going to be on medication for the rest of our life. So it's something powerful that you are doing, and looking forward to seeing it. Do you have any social media pages that you can share with the public?
Yes, you can go to National Wellness Centers on Facebook. Do a search for that. You'll see all the information about all the projects that we are working on. It's also on Instagram, National Wellness Centers.
Okay, wonderful. Director Dr. Neptune, thank you so much for being with us this morning, and looking forward to this continue to grow throughout the Twin Island Republic, because we need it as a nation.
Sure, thank you very much.